Hi, welcome to DentaVacation discussion forum. This is a really great place to ask questions and have conversations related to dental work. Your questions and comments help us decide on future topics. Hi, Dr. Komal.
Hi.
We have a lot of clients asking us about dental implants versus dentures.
Okay.
Can you educate us on that, please?
Sure. For this, we need to discuss both implants and dentures separately. So let's talk about dentures first. See, dentures are basically artificial teeth which are placed on an acrylic plate inside your mouth. These cover your gums and the bone. So there are different types of dentures available. If you have one or a few missing teeth, you might need a partial denture, which means only a few teeth will be, replaced. If all your teeth in one arch are missing, then you'll need a complete denture. And most elderly people nowadays have complete dentures. When we talk about implants, implant is basically a screw-like object which is made of titanium. Now this titanium is biocompatible, which means that it won't harm any of your oral tissues. It's compatible with them and it doesn't cause any allergies. Now again, implants can be of various kinds. It can be a single unit implant, or it can be multiple implants, or even implant systems are available nowadays. For example, an all-on-4 and an all-on-6. This means that 4 implants are placed in your arch and it's covered with a denture. So it's also known as a hybrid denture.
So now we understand what is a denture, what is a dental implant, but how do we choose? What are the advantages and disadvantages?
Okay, so about dentures, some elderly people tend to have this psychological makeup that they like to remove their denture every day and clean it up and then put it back again.
Oh, so it's like some people get this high, or it's like meditation for them. Cleaning dishes is meditation for them.
That's right.
Okay.
Now another thing is that an implant will require surgery, and some people don't want surgery. Some people are very skeptical about it. So those people might go in for dentures. When we talk about the disadvantages, well, there is a huge list. Let's talk about it one by one. The first thing is that a denture tends to cause a lot of bone loss. Now over the years, you start losing bone, and many of our senior patients have a sunken cheek appearance. That is also because they've lost a lot of bone over the years. And the reason for this is the denture itself. Secondly, dentures tend to cause infections as well. There is a space between the denture and the oral tissues which tends to accommodate a lot of bacteria over time. So this can lead to inflammation and uneasiness and even infections. Now of course it can be cured with medication, but then why would you want to take that risk? So the third thing is that dentures also tend to impact your speech and your taste sensations. How they do that is the upper denture tends to cover up the roof of the mouth, and this part of your mouth contains taste buds. So again, when it's covered, it won't be functional.
Okay.
Another thing is, when we come to speech, you'll notice that you can make out when a person is wearing a denture just by the way they speak.
Yes, I've seen in social gatherings some seniors, they tend to not have a very natural flow of speech.
That's right, and the denture is the reason for that. Another thing, when it comes to social gatherings, many patients have complained about embarrassment in such situations because the denture sometimes comes out. When you open your mouth very wide, or you yawn, or you laugh, it tends to dislodge. So this is another very big disadvantage, and it can be very embarrassing in a social setting. Even what you can and cannot eat is governed by the denture. If you're wearing a denture, there are some foods you need to avoid. For example, sticky foods or hard foods. These tend to dislodge your denture again. Another thing is that because of this very reason, many patients tend to have malnutrition because they can't eat everything that they want.
At MTC, we come across a lot of clients requesting dentures because they are cheaper and they think it's more cost effective. What is your say on it?
See, definitely the initial cost of a denture is much less than that of an implant. But over the years, a denture needs relining and it may need to be remade as well. The reason for this is that dentures tend to cause bone loss, as I told you. So to accommodate for this bone loss, a layer of acrylic is added underneath the denture.
So realigning is something which over time needs to be done in case of dentures.
That's right.
Okay.
And this is essential. I mean, there's no case where this is not done. And when it comes to implants, it's a very permanent solution. You won't need any redoing. So definitely implants is a better option here.
Wow, that's a long list of disadvantages. How about dental implants?
See, dental implants, the first and foremost advantage of dental implants is that they tend to bind with the bone. This process is known as osseointegration. What happens is that the implant tends to stimulate the bone to form, and this bone formation will fuse with the implant. Now this produces a very sturdy structure, and it lasts much longer than a denture does. So another advantage of dental implants is that you can eat and drink anything you want, as opposed to dentures where you can't eat a lot of foodstuffs. Now for this reason again, there's no chance of malnutrition.
So what is more natural? Is it implants or is it dentures?
It's definitely dental implants. Many of our patients in fact have given us a feedback that their implants feel very natural. You can eat anything, the appearance is very natural, and you know, generally in your everyday life you don't feel like you have a foreign object in your mouth.
So are there any disadvantages of dental implants?
See, for some people who don't want to go for surgery as it is, surgery itself is a disadvantage. But again, I would like to tell them that it's done under anesthesia. You will not feel anything, and once it's done, you will be happy that you went for it. And secondly, one other disadvantage is that the healing period takes about 3 to 6 months. So during this period, as I told you, the bone and the implant are fusing to each other. And this is a very important period for your implant success.
But this is not a disadvantage over dentures, because even in case of this healing period, you can pretty much eat everything what you would be with dentures, is that right?
That's right. You do get temporary prosthesis during this healing period. Of course, it's not as strong as the permanent prosthesis, but it does all the work that a denture can do.
Are there situations where dental implants are not recommended?
Yes, there are some situations where dental implants might not be a good procedure to go for. For example, if you have uncontrolled diabetes or uncontrolled hypertension, or things like a heart condition where surgery is not recommended, or even for cancer patients who are undergoing radiotherapy. These are the situations where you need medical advice to go in for any kind of surgery, elective surgery that you want.
So what would you recommend, dental implants or dentures?
See, I would definitely recommend dental implants to my patients. The reason for this is that the success rate of dental implants is around 95 to 99% in a healthy patient. Now even patients who are aged 80 to 90 years can get implants successfully. Another reason is that they last much longer than dentures. Their longevity is around 5 to 8 times of dentures.
Thank you, doctor. To our viewers, if this information is helpful and you think it will also help somebody else, please share this video and show us some love by subscribing and liking our channel. Thank you.